Okay, I'm going to kick it over to our presenter, Andrew. Welcome.
Thank you very much, Sue. Good morning, everyone. I'm really excited to be here. I'm grateful for the opportunity to be able to share and present today. But I'm also a little bit nervous because brevity is not my strong point. And so 20 minutes is like the greatest challenge to present in. And so I'm looking forward to this challenge and hope that we can engage in this topic together of advanced care planning. So my name's Andrew Saunderson. I'm with the Fraser Health Advanced Care Planning team. We're really fortunate here in Fraser Health. We actually have the largest advanced care planning team in all of Canada, and we're leaders internationally in the field of advanced care planning. And so this opportunity to just kind of share a few simple principles of how you could start your own advanced care planning, and then how and where you could find out more information is kind of what I hope to accomplish in these 20 minutes together today. Now, as we begin any presentation, I do want to acknowledge that Fraser Health provides our services and our education on the unceded and the traditional lands of the Coast Salish nations. I myself am actually coming to you on the unceded and traditional lands of the Katzie Nation, and want to express my gratitude for the stewardship and care that they offer to these lands that we're so able to enjoy and find grounding in during this pandemic. So what I love about advanced care planning is that we're able to break it down into 5 what we call simple steps. And those 5 steps are think, learn, decide, talk, and record. And what I appreciate about this graphic, if you're like me, and maybe it's because it's almost lunchtime, but this looks like a pie to me. And when I eat pie, my mother always still cringes, but I never eat it in the polite, linear way that you're probably supposed to. For me, it just depends how hungry I am or how much I enjoyed that last piece, for which piece I'm going to go back for. And it's the same thing with these 5 steps of advanced care planning. While I intend to share them with you today through in an orderly manner of 1 through 5, really advanced care planning is starting where you're at and then going to the next step of where you're at. It does not need to be done in one step after another. You can start at think, head over to talk. You can spend a lot of time and learn, and then maybe head over to record, and then spend some time and decide. There's no need to do these steps in a linear fashion as you partake of this pie of advanced care planning. So let's jump right into these 5 steps. The very first step that we want to share with you is think. And what is it that we're asking you to think about? Well, we're asking you to think about what brings your life meaning, what brings your life purpose, and what brings your life joy. And the reason why we've asked those questions is you're probably wondering, what does that have anything to do with my health? Well, whether we know it or not, our values inform all of our life decisions. So our values inform the clothes that we choose to wear, the food we eat, the friends we have, and even choosing to attend today's presentation was a values decision about what's important to you. And so it's the same thing with our healthcare decisions. We make our healthcare choices based on what brings us joy, what's important to us. But if I asked you what your values were, it's a pretty abstract question. But by focusing on what brings us joy, or what I call making a joy list, or writing down what a good day looks like for me, I'm able to ensure that the healthcare decisions I make allow me to live the way that I want to live. So a really quick story that I'll give you is when I was working in oncology, so on a cancer unit in the hospital, I remember meeting with a patient and asking that patient what it was that brought him joy and what was a good day for him. And this poor gentleman, having been through multiple cancer treatments, couldn't think of a single thing initially, until finally he realized that there were really only 2 things in the world that brought him joy, and that was ordering pizza and watching CNN. 2 things that bring me absolutely no joy, but to this man, they were the 2 things that brought him joy. Now, what does that have anything to do with this healthcare decision making? Well, you can appreciate that when the oncologist walked in the room to offer more treatments, he was able to discuss with the oncologist whether he was still able to order pizza and watch CNN. And similarly, when he was working with our physical therapist to improve his strength, we knew that the goal was not for him to be able to run a few kilometers. The goal was simply to get him from his bedroom to the living room so that he could watch CNN. And so, again, reflecting on what a good day looks like or what brings us joy and meaning in our lives is a critical part of advanced care planning when we think about how we want to live, because that's really what advanced care planning is. It's not about how we want to die, it's about how we want to live. The second step of advanced care planning is learn. Now, what is it that we're asking you to learn about in relation to our healthcare decision making? Really, we're asking you to learn about a few different things. We're asking you to learn about your preferences for receiving medical information and even for making healthcare decisions. Often we don't realize that some of us like a lot of information related to our health. We'll even go to Dr. Google after a doctor tells us more about what's going on for us. And some of us like the bare minimum. Some of us like to make healthcare decisions completely independently, and others prefer to make them completely relying on our family. And so again, reflecting on our preferences related to that is important to learn about. It's also important to learn about your health. What's going on for your health and what does it mean for your future self? I always tell people that when we're diagnosed with a new health issue, we're quick to see what that means in general terms, but it's more important to have a discussion with your healthcare provider about what does that mean for you in specific terms. So what does a diabetes diagnosis mean for you in your life and how you want to live? What does a congestive heart failure diagnosis mean for you and how you are choosing to live, or what the future looks like for you in 1 to 3 to 5 years living with that health issue now? We also explain that it's important to learn that there's actually laws and legal documents here in British Columbia that are related to healthcare decision making. And within these 20 minutes, I hope to highlight some of those laws and those decision making documents as well, just to highlight them. So what are some of the legal documents that we have here in British Columbia? Well, if you're like me, I'm an immigrant to British Columbia. I'm from Ontario originally. And in Ontario, they have different healthcare laws, as they do in Alberta and every other province and jurisdiction here in Canada. So in Ontario, for example, a power of attorney is both for your financial and your healthcare decisions. That's not the case here in British Columbia. In British Columbia, when you complete an enduring power of attorney, that's only for financial and legal decisions. If you're wishing to legally assign or complete the legal documents to assign someone to make your healthcare decisions for when you're unable to make decisions for yourself, that's called a representation agreement. And so as you complete that representation agreement, you're essentially assigning someone to express your healthcare wishes and to make your personal care decisions when you're unable to communicate them for yourselves. And finally, there's a last document that we have here in British Columbia called an advance directive. Now, an advance directive is a legal document that we hope you complete with your healthcare provider, not with a lawyer, not because we don't like lawyers, but as I like to say, when my car breaks down, I don't take it to my hairdresser. I take it to my mechanic. And so when we're choosing to do a document that's about healthcare decisions, we should be talking to our healthcare providers so we really understand the risks and the benefits to the decisions that we're making. Because what an advance directive document does is that it's you clearly articulating um, treatments that you for sure want and for sure never want. So perhaps you have religious reasons that you never want a blood transfusion. That's a very good time to do an advance directive. Perhaps you've been in the hospital 5 times in the last year and have had a breathing machine on all of those admissions, and it's just been so exhausting and not allowed you to live the way that you want to. That might be a good time to put that on there as well. But those are decisions that are really important to talk about with your healthcare provider to understand the benefits and the consequences of having to make those decisions in advance. Decide. Now, the decide section, if this was a workshop that we were doing for an hour and a half with you, this is where we get the most engagement and questions, because I think people don't realize that if we don't make decisions for ourselves or plan in advance for ourselves with our healthcare, the law will actually decide for you. And there are laws that will dictate that. And what do I mean by that? Well, the first place where we like to start with the decide section is to actually ask you to think about the qualities of who you would want to make decisions for you when you're unable to do it for yourself. And the reason why that's so important is because we often have someone in mind, but we haven't actually thought about the qualities of what makes someone a good substitute decision maker. And what do I mean by that? Well, usually the answers we get from folks in the public is that they want someone who's trustworthy, someone who's good in a crisis, someone who knows their values, someone who potentially even has the same values, someone who's a strong advocate, a clear communicator, and a good listener. Now, the reason why focusing on qualities is important is because there might be a lot of women on the line right now who are just like, that's not my husband. All right. And that's okay. You probably didn't marry your spouse for the reason that they would be a good substitute decision maker. When we're choosing someone to be that substitute decision maker or that representative for our healthcare decision making, it's not a love competition. It's really about choosing the person who is right for you to honor your wishes in that moment of emergency or medical decision making. So here in British Columbia, we have these laws that essentially articulate in a list of who we need to go to get consent for healthcare decision making at any stage or any place or location of care. I hope it's a relief to know that when it comes to any healthcare decision making, if you're a capable adult, we are always going to go to you. It does not matter whether your aunt or your cousin is screaming louder than you, or your mother wants a totally different treatment. As long as you're a capable adult, we are always legally required to go to you as a healthcare provider. Now, if you are not a capable adult, and I want to remind you that that can happen at any stage in your life. We sometimes think that when we lose capacity or aren't able to communicate for ourselves, so that's only when we're seriously sick or when it's at the end of our life. But the example that I always give is that as I go on my daily walk these days, if I were to get hit by a car on my walk and I were unconscious, even just for a couple of hours, even in those couple of hours, healthcare decisions will have to be made and someone would need to make them for me. And so that's really important to understand. So if you are not capable in that moment, we would have to go to what's called a court appointed committee, which is basically a legal guardian. Now, this is very rare. In my 12 years of being a social worker, I've literally never seen a committee of person, but I have colleagues who have seen a handful of them. Essentially, this is when a family has gone to a court and asked a judge to assign someone to be a legal guardian for someone who does not have the capacity to make decisions for themselves. So typically, this is people who have severe developmental disabilities or mental health issues. You can appreciate that if a court has assigned someone to be a guardian, it makes sense that they're the first person we need to check with to go for decision making. But because most people don't have that, we're going to keep going down that list to letter C. And we're going to ask if you have a representation agreement completed. Okay, there's two different representation agreements. We're not going to we don't have time to get into both. One's a representation 7 and one's a representation 9 agreement. And that representation agreement is where you've in advance chosen someone to be your healthcare decision maker. And there's even an alternate representative on that form. So in case we're not able to get a hold of your first representative, someone is an alternate. Now, let's say, because a lot of us in British Columbia don't have a representation agreement completed in advance, we're also going to ask if you have an advance directive completed as the next step on this list. And that's because if you've already legally said you do or do not want certain healthcare treatments, we have to honor that. All right, we have to legally follow that because you've already made that decision in advance. The situation we fall into with most of us, because I assume that most of you who are even watching this today possibly don't have a representation agreement, likely don't have a legal guardian, and possibly haven't even completed an advance directive. And that's fine. Not all of us need it and not all of us have done it, and that's okay. But when you look at that temporary substitute decision maker list, this is where the law tells us to go if we want to make when we need to make healthcare decisions. And so the very first person that we're going to go to is your spouse, if you have one. And that spouse could be a common law. It could be same gender. We're then going to go to your adult children if we can't get a hold of your spouse. If we can't get a hold of adult children, we're going to go to your parents, brothers or sisters, grandparents, and so forth. Notice between 2 and 6 in that list that it says equally ranked. This is really important because sometimes we might feel either for cultural reasons or just for closeness of relationships that we want a certain adult child to be the one that they go to, or we want them to go to one parent but not to the other parent. In British Columbia, they're all equally ranked, meaning that they all have a vote on the island when it comes to healthcare decision making. So if you have a specific child or even a specific parent or brother or sister that you prefer, that's a really good time to do a representation agreement so that you can already in advance ensure that we go to them first. Then you'll notice it goes all the way down. We have a lot of seniors who very quickly look at this list and say, you know what, Andrew, I don't have anybody on that list. Who are they going to go to if I'm not able to make decisions for me? Well, there's an organization, a government organization called the Public Guardian and Trustee, which is that number 10 at the bottom. The Public Guardian and Trustee is someone that we would reach out to when we're not able to get a hold of or there's no one in that person's life for healthcare decision making. Now, this is my favorite part about the Public Guardian and Trustee because some people get uncomfortable with the idea of a government organization making healthcare decisions for them. They don't want to be in that situation any more than you want them to be in it. Okay, so what's nice about that is that when you call them, as I have many times in the past, they want to learn as much as they can about that person so they can honor their values, right? They want to know what brings that person joy, what does a good day look like for them? And they'll do as much research as they can to ensure that the decision that they're making is honoring what's important to you. Moving along, again, some of you might have gotten some pits in your stomach when you looked at that list and you're just like, oh my goodness, I'm estranged from my brother. I hope they never call him. Or I have a terrible relationship with my parents. That's okay. There's certain qualifications for someone to actually be that substitute decision maker. First, they need to be 19 years of age. All right. So here in British Columbia, that's the age of consent. And so that's important. They also need to be willing and capable. My spouse in a healthcare decision making moment might not be willing and capable in the moment because she's so overwhelmed with the emotions of the situation. She can decline. They need to be capable. If unfortunately someone in our family has any sort of cognitive, degenerative disease or challenges, they're not necessarily the person that we're going to go to. There also needs to be no dispute or conflict with that person. So if you do have conflict, if you are estranged, that immediately disqualifies them as someone that we would go to as your substitute decision maker. They also need to have had contact with you in the last 12 months as a way to ensure that they actually know you and what's important to you and how you want to live. And my favorite part about the laws here in British Columbia, and I know that sounds very nerdy to say I have a favorite part about the laws, but this is my favorite part. It's that the number one responsibility that substitute decision makers have here in British Columbia is that they are legally obligated to honor your wishes. So if there is any time where a healthcare provider has reason to believe or know that your wishes are not being honored or your values are not being honored, that person will be disqualified and we will make sure that your wishes are being honored and followed. That was a lot. I'm sure some of you have a lot of questions about that. And in our workshops, our public workshops that we offer, you're welcome to ask more questions and engage with that topic more. The fourth step is talk. Who are we asking you to talk to? We're asking you to talk to everybody and anybody. Talk to the people who give you strength and support. Who do you go to when you're having a good day? Who do you go to when you're having a bad day? And talk to those people. Talk with those who are important to you and have conversations. Remembering that this isn't a conversation about death and dying, which can often create barriers to having these conversations. This is about just telling people in your life what's important to you, how you prefer to live, what are the things that bring you joy. And so I often get people from the public who say, you know what, the best way for me to bring up this conversation is by using real life examples like Tiger Woods was just in a car accident. Can I tell you what I would want if I were in a car accident like Tiger Woods? Or COVID has presented an opportunity for us to be a little bit more aware of our mortality, to then share with those who are important to us and say, you know what, if I were to get sick with COVID, can I tell you what would be most important to me and how I would want to live after that diagnosis? And finally, that last step is record. And recording is obviously a creative way for you to be able to document it. And by creative, I mean, it doesn't need to be on paper. So in our virtual tables, as part of this fair today, we've provided you with 2 different documents that you could use to record your wishes, but you could videotape them, you could audio record them, you could put them in a poem. We've seen multiple ways that people record their wishes. On this page, we've just shown you an example of a page from the My Voice booklet that you're able to record on. So I'm aware I've got 2 minutes. I'm going to use them wisely. And that green sleeve at the bottom is basically an envelope that we share with everyone who comes to our public sessions as a way for you to store all your medical important information and all your advanced care planning documents in there for your record keeping purposes. So in closing, we've shared just a few different resources that you can go to. But most importantly are these phone numbers and this email address that I want to share with you, because it's by going to our website, which is fraserhealth.ca/ACP for advanced care planning, where you can find a list of our upcoming public sessions. You can come to those sessions where we go into far more depth about these 5 steps. You can ask far more questions and then also get access to all the resources by calling that phone number or emailing us at that email address. How was that, Sue? Was that good for 20 minutes?
Holy smokes, Andrew. I think you just gave us an hour's worth of amazing information in 20 minutes. Thank you so much. The time means that we don't have time for a Q&A now, but I believe there are some materials that you've provided for us on the virtual flyer table down at the bottom of the web page. Just scroll down there on the main menu web page, and you can look at some PDFs, print them out if you like, or save them on your computer. And seeing this phone number and this website, we know how to get in touch for more information.
Absolutely. Thank you so much.
Thank you. This is awesome. Thank you so much, Andrew. Thanks everyone for joining us in this session today.